barcode display system gives us in theatre a real life-size image of the patient that we're about to treat. In my specialty, such as tumours, you can readily see in the high definition of the tumour, the surrounding tissues, which allows more precise surgery to excise them.
We had a very strong relationship with Barco throughout the implementation, starting right back at the beginning when we were asking for demonstrations of the equipment in theatres, all the way through to selecting the right equipment and then actually implementing it in our theatres.
We cover the complex arm of orthopaedics. For instance, we have a super-regional bone tumour unit, one of only 2 in the UK. We also have a scoliosis unit, the largest in Europe. On top of that, we have orthopaedic surgeons that cover every single discipline of every joint. And because of that, we train 15% to 20% of future orthopaedics in the UK. Our aim is to provide the highest calibre of care for patients. But if we can be more efficient, we're always ready to embrace new technologies.
Before the RNOH implemented PACS, the surgeons would view film rather than any other means of looking at images. These films were often up to 90 centimetres in length so that they could view the whole spine or the whole lower limb of the patient. And in addition to that, the surgeons have to view multiple images, so they in theatres would have up to 4 or 5 different sets of images up on light boxes. So light boxes took up a lot of space in our theatres. The new display system required by the RNOH for theatres had to fulfil certain requirements, and first and foremost of this was the requirement to be able to display DICOM images in our theatres. But in addition to this, as project manager, I was looking for something that would be easy to install, because the theatres are the powerhouse of an orthopaedic hospital, and I couldn't afford to have any theatre downtime because of a building project. And once it was up on the wall, I needed to know that it was going to be reliable, something that wouldn't fail, wouldn't break down, and that's why we wanted to have a product like Barco.
Wherever you stand in the operating theatre, you can see the image, and with minor adjustments to the position, you get a really clear, good quality image from a distance, even with high ambient light.
The staff in theatres are very appreciative of the high quality facilities they've got for viewing images, particularly the surgeons, and anything that improves the flow through theatres improves the efficiencies of the whole organisation.